Hello, so I'm going to administer flip enema. First, in the assessment phase, we need to gather all the equipment needed, such as split enema, disposable linen saver, bath blanket, clean gloves, bedpan or commode, water-soluble lubricant, and paper towel. Assume that we all have those equipment. So for the nursing diagnosis, it is the constipation related to pain on defecation, secondary to hemorrhoids, AEP patient reporting that she has no bowel movement. So for the nursing outcome, the patient will have a bowel movement before discharge. Moving on to the nursing intervention. Um, First, of course, we need to introduce ourselves and verify the client's identity. Assuming that we're done introducing ourselves, we're now moving on to perform hand hygiene and the wearing of gloves. After wearing our gloves, we need to provide the patient privacy by closing the doors or the curtains. And we're now going to place the bedpan if we have, um, assuming that we have a bedpan and it's already done. And now we're going to assist the patient to the left lateral position with the right leg as to facilitate the flow of the oculate flex as possible. When we are done, we will going to insert tubes smoothly and slowly when we were going to administer solution. Assuming that this is the solution, the angle follows the interrectum directing towards the umbilicus. After that, we're going to roll up the plastic container as the fluid is sterilized. We're going to do it after care. Then we're going to wash our hands. Moving on to the evaluation phase, we need to record any significant problems such as redness, discoloration, swelling. Episiotomy should be noted for the edema, inflammation, separation, or presence of hematoma. Of course, we also need to note the amount of color, odor of any discharge. We also need to document the client's tolerance of the procedure. That's all. Thank you. So hello, I'm going to do an infant bath. For the assessment method, of course we need to assess the family preference or the fit bath time into the family schedule. And also we need to assess and check the infant's body temperature prior to bathing. So for the planning, of course, we need to prepare all the needed materials, assuming that we already completed all the materials needed. We're now moving on in performing hand hygiene and put on our gloves or PPE. Since I don't have PPE, I'm just going to wear the gloves. After wearing gloves, we need to introduce ourselves to the mother and identify the patient using name and birthday. Of course, after that, we're going to explain the procedure to the mother and provide client's privacy. After that, we're going to prepare lukewarm water and we're going to check it using our elbow. After checking, we need to place the towel lid on in diamond fashion on the table. And then we need to remove all the clothing of the infant except the shirt and the diaper. Assuming that we already removed it, we're now going to get a moistured cotton ball and we're going to wipe the eyes of the infant. So after that, we're going to dip washcloth and make a mitt, and we're going to wash the face and the ears of the infant. I'm going to hold an infant on one arm over the tube and wet her hair. Assuming that we're already done, we're now moving on to place the infant on the towel and dry the head using the corners of the towel. After that, we're going to undress the infant, the shirt and the diaper. And we're going to pick up the infant slowly, lower him into the bathtub, and rinse. We're going to dry the infant gently. And after that, we're going to clean the genitalia. We need to separate the labia with a cotton ball moisture and redress the infant. We're going to hold the infant for a period of time. So for the evaluation, we need to document the body temperature and the time